In the field of MR imaging, physicians have long faced the dilemma of finding an MR system that could deliver high field performance without sacrificing patient comfort. That perfect system never quite existed, until now. You found Oasis. Oasis is the patient magnet with a distinctive open design for unparalleled patient comfort. Yet it delivers the clinical performance and image quality required for the most demanding clinical environments. Oasis is inviting and reassuring for the patient. Oasis reflects Hitachi's exclusive and extensive experience in the design of patient-centric MRI systems. The unobstructed patient view, large vertical gap, asymmetric table alignment, and high-capacity table provides the most comfortable scanning environment. The unobstructed view assures Oasis patients experience true comfort, as well as the speed offered by the most powerful open high-field MRI. Oasis vertical field technology provides an open advantage in patient satisfaction and comfort. Anxious or elderly, large or small, all approach the Oasis with less apprehension. Oasis is the most powerful high-field open system available, offering advanced RF technology, an easy-to-learn and use platform, and ultra-fast gradients for uncompromised image quality. Multi-channel RF and Zenith technology coils are unsurpassed in comfort, seamless workflow, and support for a broad range of clinical applications. The ultra-wide table and lateral movement feature provide versatility for the most challenging studies. Oasis imaging suites deliver diagnostic confidence. All of the most desired neurological, vascular, body, and orthopedic studies are possible with the Oasis. Breakthrough capabilities like HOST, higher order active shimming technology for excellent RF fat saturation in every clinical situation. Radar motion compensating technique, TRAC, time-resolved MR angiography, and rapid parallel imaging, combined with Hitachi's ongoing commitment to advancing capabilities, assures enduring value for years to come. No longer do physicians and patients have to choose between comfort and clinical performance. Oasis from Hitachi delivers both. An open, welcoming system with greater patient acceptance and high field performance. Oasis, the patient magnet from Hitachi.
Well, the Oasis system is unique in that it's an open design where there's it's like a clamshell, if you could imagine that, and there's absolutely nothing between the patient and the outside world.
It's different from what's called a wide open magnet, where the tunnel of the magnet is a little bit wider than a traditional MR, but still it's sort of like going into a small tunnel or torpedo tube, as I like to say. And in those cases, the patients can still feel very claustrophobic. That is different from our system. The patients don't feel that claustrophobia, that closed-in feeling that they get with the other types of MR units. And so our Oasis open MR unit is unique in that way.
It's a perfect kind of a scanner for the bariatric or the pediatric patient. Because of that design, in the pediatric environment, the patients themselves can often see their loved ones. They can be in the room with them if necessary. In the bariatric environment, of course, there's easy egress out of the magnet and easy entrance into the magnet without the confines of the traditional sort of system.
The technology allows us to look at all different parts of the body and look at the different tissues and distinguish different tissue types from bone, from soft tissue, from fluids. The MR allows us to distinguish all of those a little bit differently so that we can really find the problems that the patient has, provide great images for not only the patients but for their physicians as they manage the different diseases that the patients have.
It allows you to do this high quality, rapid imaging, and yet it's in a completely open environment to allow for patient comfort. So now we have patient safety, patient comfort, and a high technological combination that really sets this Oasis system apart from its competitors.
With the new technology, we can modify our protocols, which is what kinds of images we take, and do more protocols without having to inject any contrast. So we can sometimes avoid having to place a needle into the patient, inject some contrast, and still get high quality images during the examination.
This kind of a system will allow us to provide the vascular surgeons with information regarding their lower extremity vessels, their renal arteries, carotid arteries, just about every place in the body that you can think of that were previously inaccessible without the use of intravenous contrast or radiation.
The strength of our magnet allows us to do better imaging for orthopedic type cases, for neurologic cases. We can do thinner images, we can do different sequences, and we can still do it in a timely manner, probably faster than we have been in the past.
When you're trying to do high-quality scans, especially in patients who are technically challenging, perhaps because of their size. It's important to have a system that will allow you to narrow down the slice thickness as narrow as it takes to be able to find the disease processes.
Not all of our patients can tolerate the traditional MR, so having an open MR as a alternative for their imaging is very important.
And I think that if you talk to the patients and you ask them to point to something that they would call an open magnet, that's what you're going to see.